the questions that you get about like are full of words and have quotations in them are usually therapeutic communication questions. So we'll see when we start working with them how they typically look. So you'll learn how to recognize them. You'll learn how to say, okay, therapeutic communication question. I have a formula for answering them, and then you'll feel more confident. I'm going to go back to the stand store so that I can show you where you're going to find this material. All right, this material on therapeutic communication comes under Lesson 6, Part 1, Psychiatric and Therapeutic Communication. It's a 44-minute lecture. And if you click on here, it's going to take you and link into your course slides and go to Lesson 6. All right, so let's just say that we are on our course slides here. We'll return us to the table of contents and go to Lesson 6. The Google Doc notes are here on the cover page of lessons or session 6. I don't want to get sessions confused with lessons. Sessions are covering a range of topics in one of the 8 sessions, whereas lessons are like those subtopics within those sessions. All right, so session 6 Google Doc notes are here. So you'll click on that. You might notice that other members are on the doc along with you, and they too are checking out the document. I'm just going to kind of move that out of the way so we can open up this um, as wide as we can here and make this a little bit more visible. And this document for session 6 is covering a lot of material because as you get closer to the NCLEX, you're going to want to mix up your study according to your study plan, of course, but sometimes you're going to find that you're studying multiple high yield topics and over the course of the weeks that you're studying for NCLEX, right? And so high yield, and by high yield, I mean those topics that are guaranteed to be on the NCLEX. So psych mental health, therapeutic communication, absolutely, you will see those questions. It's not a matter of if, but just when, and possibly a matter of the level of difficulty of the question. If it's one of the easier questions, which you tend to get at the very early part of the NCLEX because it's kind of moving you through complexity, right? And it's getting more complex as you answer questions correctly. So you're going to want to know how to answer the most complex questions so you can get the most bang for your buck and score the most difficult questions correctly and pass that NCLEX in the minimum amount of questions or as few questions as you can, right? So with that said, psych mental health is just one of those high yield topics, and therapeutic communication, you will see those concepts. So quickly, um, so you're probably not this deep into your nursing curriculum at this point where you are fully engaged in the relationship phase. But tell me, have you heard about the various phases of the therapeutic relationship? Have you had that covered yet?
I think we went over it like briefly.
Okay, good. All right. Well, then we'll briefly remind you of those phases. All right. So it's pre-interaction, which means you have not met that patient yet, but you are preparing for them. All right. And here's how I like to think of the relationships, or how I like to think of the type of nurse we're working with on NCLEX questions. NCLEX is a safety exam, right? It really wants to know if you have the basic tools to be a safe nurse in your first years of nursing. All right. So it's going to be throwing at you complex scenarios that may or may not feel stressful to you because it depends on your level of knowledge around those topics, those safety topics, right? But if it comes down to like a medication, do you know the safe administration of medication, the rules around safety? When it comes to therapeutic communication, there are some rules around what's appropriate, what keeps the patient as safe as possible, and what keeps you as a healthcare worker, healthcare personnel safe as well. All right. So I like to think of those nurses as emergency, or I like for you to think of yourself or put yourself in a scenario where you are an emergency room nurse. All right. The emergency room nurses have brief contact with their patients, but they still have to go through the entire nursing process, and they actually have to apply these principles of psych to their interactions with their patients as well. And one good thing about it is that they're going to have quick interactions. So though they go through all of the parts of the relationship phase that you see here, they're going to go through them much more quickly. All right. Versus say a health promotion nurse that's working with clients in like say a smoking cessation program where they're going to be coming back and forth to therapy over possibly periods of weeks. All right. There would still be those phases of these particular phases of the relationship that you might see with a patient who you're seeing over the course of months, right? But with an ED nurse, you're getting it all in perhaps 1 hour, right? So it does still give you an opportunity. And NCLEX loves to use an ED nurse as the um, the nurse that the patient is working with. And usually it's because we can get to a lot of information quickly. All right, or we can go through the nursing process quickly. That said, pre-interaction could be a phase that's happening before you even meet that client. Um, say you hear that there's a 5-car pileup on a highway and that you're getting ready to receive two of the casualties in that car um, collision, right? And so you are preparing for that patient before they even get there by perhaps getting all of the supplies needed to handle a patient who might come in with breathing problems, broken ribs, or broken bones. I mean, generally you have some information that's being provided to you before that patient arrives. All right, but then there's the introduction or orientation phase where you're getting to know that patient, collecting history from that patient. Are they conscious? If so, can you talk to them? When you're talking to them, are you gaining information that's going to help you understand where their injuries are? Again, you're an ED nurse, right? Even if you don't want to be an ED nurse, think of yourself as one, and you'll think about having to move through this process quickly. All right. And then you're orienting yourself with the patient. Perhaps it's a childbearing age teenager and who thinks that they might be pregnant. All right. So there's certain things that you're not going to do for a pregnant patient that you would be able to do for a patient who is not pregnant. All right. Like, for example, considering the age of the fetus and whether or not the fetus's life will be prioritized over the mother, or whether or not the mother's life will be saved in priority over the fetus. Now, those are some deep questions to begin thinking about, but actually, those are all happening in the orientation introduction phase. Now, the working phase is where we're actually doing nursing interventions, right? We're drawing blood. I mean, that could be part of the orientation phase, right? You're talking to them while you're drawing the blood. But the actual nursing interventions are things that you do related to the nursing process or your nursing diagnosis. All right. So working phase is all the types of interventions you might do. Perhaps you place a catheter. Perhaps the patient needs a chest tube, right? And you're going to stand by with the doctor to insert it. So there's a lot that could be involved in the working phase. You could give them a nebulizer, you can give them oxygen. There's a lot of nursing interventions that you could do here. But then comes the termination phase where you would think that's not a big deal. When they're done, they can just go. They can be admitted into the hospital or they can go back home and treat them and treat them. What happens there? Well, termination phase is important because that's where a lot of the therapeutic communication comes in. All right. You're seeing people on the worst day of their lives often, and they need a lot of information. Hopefully, they are conscious and they can talk to you and they can express themselves, but sometimes they are altered. They're not alert and oriented times four. Sometimes they're just anxious. They are alert, but they're overly anxious because they're experiencing some stressor that they didn't have before this condition that brought them to the hospital. So termination phase gets to be very tricky because you can't just terminate with a patient by saying, I'm done with you now. Okay, you can go now. I don't need to see you anymore. You can't exactly terminate. It's not therapeutic, right? So you want to do everything that we do when we're communicating. We want to get to what it's going to take to help this patient get better. So even the termination phase has to be thought out. All right, so with that in mind, let's go through some of the tricky things that come up when you're working with a patient around communication, and then we'll do a few questions. All right, so a big point is gift giving, no gifts. All right, whether you're working with a psychiatric patient, and again, NCLEX sometimes has you working with a patient with a diagnosed psychiatric disorder. Sometimes, no, it's just a regular person off the street, and you don't know what they're going through or what their psychiatric diagnosis is. Maybe they are not a psych patient, but they are going through some kind of altered mental status right now because perhaps they've had a concussion. Or maybe they have type 2 diabetes and they're not behaving the way they normally do because their blood sugar is low. So people can get altered sometimes and seem like a psych patient, but they're actually just having a fleeting moment of altered mental status. All right. So with that said, whether it's a psych patient or not, you want to still apply these principles. Now, if you are working with a patient who does have a known psychiatric disorder, you don't want to be receiving or giving gifts. Well, any patient, right? You don't want to receive or give gifts, particularly a patient with, for example, a patient with schizophrenia thinks they're giving you a flower, or thinks they're giving you just a dandelion that they picked out on the out on the grass of the facility where they live, right? And they give it to you, and they think you think it's not a big deal, it's just like a buttercup. It's not a big deal. And so you find out later they thought it was a marriage proposal, right? And they were serious about it, right? But because of their mental state, it's quite possible that you made an assumption that it wasn't or it's quite possible that you as the nurse made an assumption that it wasn't a big deal. But because they do have this mental diagnosis, they probably, or quite possibly, were in a psychotic state and had a different symbolism or representation for that same gift. All right, so just to be clear, on the NCLEX, you are never accepting a gift from a patient. All right, never give advice. Don't give advice to your patient. Even if the patient asks, what do you think I should do? You're always going to be returning open-ended questions to them. All right, what do you think you should do? All right, if you can keep them talking with open-ended questions, you're more than likely doing the right thing on the NCLEX. If you can keep them talking using open-ended terms, that's usually the best answer to select on the NCLEX. All right. Never give a guarantee. Never give a guarantee. All right. Because if you say you're going to be fine, all right, and they start decompensating, they don't get better right away, then you've just lied to that patient. All right. Or I know that everything is going to be all right. Sometimes things are not going to be all right. All right. There have been scenarios where patients just want to know if it's bad so that they can start preparing for their own death. All right. Or they may want you to call someone so that they don't die alone. So that things can get quite dire in emergency scenarios. So you never want to be the nurse always saying it's going to be all right. All right. The patients appreciate your honesty. Now, you don't want to say, oh my gosh, you're not going to make it, because that's not your scope of practice either. It's not your place to diagnose. But you're usually in a therapeutic scenario, just wanting to just keep that patient talking. All right. Keep them processing their own thoughts. It's not about what you think. All right. Immediacy. So, whenever something seems like it's pressing for time and you need an answer right away, the best answer, again, we're going to go back to that convention, is the one that keeps them talking. Don't pick answers and when you see them in the NCLEX that have you like referring that patient to social work or referring them to psychiatric or the mental health nurse, right? Because you're shutting off communication when you select those answers. The NCLEX is asking you about what you know about your scope of practice. So it's really not trying to get you to um, select a lot of answers that involve delegating your responsibilities to someone else. In the moment, if there's an immediate scenario that's going on, it's never wrong to get your patient to talk. All right. Be concrete. It's important as a nurse to help the patient have a reality check, especially those psychiatric patients who are having a break with reality, like a psychosis is what it's called when a patient is not in reality in that moment. They're altered. They don't know who they are, or possibly where they are, or that they're having hallucinations and seeing, feeling, smelling things that are not there. Okay. Or perhaps they have delusions where they believe they are someone who they are not. All right. So you have to be concrete because patients tend to, um, in altered states, tend to, or anxious states, anxiety can be an altered state depending on how close to panic you are. Just be as concrete as possible. Don't use slang. Don't use sarcasm. Patients can take things literally when they are in a state. All right. If a patient makes up a word, this is called neologisms. When patients make up words, those are not concrete. And sometimes it's funny, or sometimes when they make up words, it seems like they're being annoying and you just want them to kind of move along. Okay, Mr. Jones, but don't just allow a patient who's operating in a psychotic state to kind of go unchecked or about reality. All right. So if they say there's a pink tiger over there, your job is to say, well, I don't see a pink tiger, but I understand that you might. Okay, for example. All right, empathy. Empathy is huge. This is a big deal. You got to know empathy. It's about feeling. So the best answers that you will see that are therapeutic communication questions are ones where you can communicate to the patient that you accept their feelings as being valid and real and worthy of action. Okay. So even these questions can get tough because the real you might feel like the non-nurse you, the non-therapeutic you might feel like, okay, so what do you want me to do about it? Right. Or maybe you feel like, all right, that's just a total lie and that's not real. Right. But the point is that a patient's feelings are always valid and real and worthy of action. So you're going to be picking those answers. You're not always going to just pick answers that placate the patient, but you are going to pick answers that allow the patient's feelings to be heard, right? You don't want to just be dismissive or, kind of overlook their feelings. That's empathy. Put yourself in their shoes. And you usually, when you do that, you get the right answer. You think about how you would want to be talked to in a moment of crisis, and that's usually the right answer. All right, bad answers are don't worry. We told them that before. It covers both telling them how to feel and, like, kind of giving them the guarantees. All right. It's going to saying like everything's going to be all right. Don't say things like don't feel. You shouldn't feel. I would feel. Anybody would feel. Most people would feel. Do not do that to your patients. Okay. This is a part of validating their feelings as real. So when you say, I wouldn't feel like that, or you shouldn't feel like that, even if you're thinking that, do not pick that answer. All right. Most people feel. Let their feelings be their feelings. All right. So once you realize that it's an empathy question, they usually always have a quote in the question, quotation marks. Then you just again put yourself in their place and ask yourself if you say those words. Sometimes you have to read the words in your head, read the words out loud and say to yourself, oh, ooh, that kind of sounds rough. When you say it out loud. I like to read everything with a little bit of sass as well. Because if I read it like that to myself and I say, well, what if the nurse is saying it like that? Then that's not the right answer. Okay. So if you ask yourself, if I say those words in an answer and I meant them, how would I feel afterwards? All right. So go and choose the answer that reflects that feeling, the feeling that you would want to have. So that's empathy. Don't choose feelings that just reflect the patient's words. All right. Choose the feeling that you would want to have. All right. So there's always with these empathy questions the thing called the sucker answer, right? The one that they want you to pick um, over the others. And it's not right. It's not correct. It's actually trying to draw out who the unsafe nurses are or the ones who don't know how to use therapeutic communication to fail them. All right. So you don't want to pick those sucker answers. You want to pick the answers that demonstrate, I know what therapeutic communication is. I understand that the question I pick should reflect what the patient, um, you do want to pick the answer that reflects what they feel. All right. Um, Not necessarily what they said, right? So you're not trying to reflect what they said all the time because sometimes they say things and you need to literally reflect what they just said um, back to them in a way that keeps things kind of open-ended. Like I understand you to be saying, and then just repeat what they say. And then sometimes they will say, no, I didn't mean that. All right. So you're really trying to reflect what they feel. So the best way to do that is to sometimes confirm what they just said, but never just kind of reflect back to them what they just said. Uh, and we'll get some examples of this. All right. This is an important concept. All right. So here I'm going to share with you. Now, if you are here on this form, you're able to just go ahead and connect to those questions. But I'm going to drop into our chat therapeutic communication. All right, so I am just going to, we'll just do one or two here. I wanted you to see what these Google Forms look like. So you've seen the Google Slides, you've seen the Google Docs, and so here is the Google form, and this is just the preferred way for me to present questions to you. All right. In this Google form format, you can provide your answers. You can get feedback right away, feedback about the correct answers, feedback about the incorrect answers as well. And you can kind of see how you did in comparison to other students taking these practice questions as well. And so it kind of gives you a sense of the harder questions versus the easier ones that more people seem to score correctly. All right, so I have many practice question sets like this is meant to stimulate your active learning. And so there are just 5 in this one. We'll see how many you, um, well, we'll see how many we can do here. All right, so you'll give your email. When you give your email, it allows you to use that functionality I mentioned before, where you can see other scores, you can get the information about your feedback by entering your email. All right, so let's start with the first question. You'll just either put in the chat or tell me what you're thinking about the correct answer, and then we'll go through the correct answers and look at the rationale on the back end. All right, so a client diagnosed with schizophrenia approaches the nurse and states, I can see the shadows moving. They're trying to tell me something. End quote. What is the best response by the nurse? Is it A, I don't see any shadows, but I understand that you do? B, shadows are just tricks of the light. You shouldn't worry about them. C, what do you think the shadows are trying to tell you? Or D, I will turn on the lights so you can see there's nothing there. What is the best response? And can I just say that the best responses questions can be misleading because a lot of people are often thinking it's a multiple choice question, so there's one right response. No, that's not what's happening with questions that ask you about the best response. As a matter of fact, those best response questions are typically telling you that there are at least 2 good answers, right? That there are going to be 2 good answers, and you're picking the one that is the better of the 2, all right? Sometimes there are 3 good answers, and you're going to have to pick the one that's the best of the 3. So, with that said, you want to kind of go in knowing that 2 are going to look pretty good to you, all right? Do you see that? Are there 2 that you like and that you're having to decide between?
Sorry, yes. I was more so looking at A though.
More so looking at A. All right. I don't see any shadows, but I understand that you do. All right. Well, we will go ahead and put in A for that question answer, and well for that answer choice, and then we'll go back and check out the others. All right. I will have to put in an email just to be able to to submit this. All right, so here's the next question. For each nurse response, identify whether it reflects a therapeutic or a non-therapeutic communication. Okay, so this is kind of like a matrix question where you're going to make and for each row, you're going to make a single choice between the two columned answers. So therapeutic or non-therapeutic. So here's the first one. Now, and we're responding to um, whether for each response, whether or not it's therapeutic or non-therapeutic. That must be really difficult for you. Can you tell me more? Is that a therapeutic or non-therapeutic response?
Is it therapeutic?
All right, we're going to go with therapeutic. Okay, you shouldn't feel that way. Others have it worse. Is that
Not
okay, non-therapeutic? Next one, I hear that you're feeling really frustrated about this situation. Is that therapeutic or non-therapeutic?
therapeutic.
Okay, and then finally, let's talk about something more pleasant to distract you. Therapeutic or non-therapeutic?
Non-therapeutic.
Non-therapeutic. All right. Let's keep it moving. All right. A nurse is communicating with a client who is expressing feelings of guilt about a past event. The most therapeutic response would be to, and this is a drop down type of question. So your three options are encourage further discussion to explore the client's emotions, change the subject to help the client move on, or provide reassurance that everything will be okay. All right, so which is the most therapeutic response, okay, to a client who is expressing feelings of guilt about a past event?
I would say it would be to the first option to encourage.
Okay, so we like the first option over the others. All right, next one. The nurse is working with a client who has just been informed of a terminal diagnosis, all right, meaning that this patient does have a terminal illness. All right. The client states, quote, I just don't know how to go on. I feel so hopeless. What is the priority nursing action? All right. So heads up, whenever you see the word priority on the NCLEX, it's really asking you to think about life or death. Okay. Priority means that if you have to consider what's most important from this list, think about life or death. All right. So that's just a little strategic note before we look at the answer choices. So, are we going to allow the client time alone to process their emotions? Encourage the client to focus on the positive aspects of their life? Acknowledge the client's feelings and explore their emotional state further? Or tell the client that medical advances are always being made and that they should not lose hope. What's the priority action?
I'm not sure. I'm debating between the last two.
Okay. All right. It's always good to be able to knock out the ones that don't make the most sense, but how are you going to decide between those last two? Tell me your thoughts as you consider which one you're going to finally go with.
I would say C because you don't want to like guarantee something to the client
Mhm.
without
Okay.
them like, without knowing.
All right, so it sounds like you like the word acknowledge, and you also don't like the idea of the D option being somewhat of a guarantee. All right, so we've already done four, and let's do this last one before we submit. All right, so a nurse is providing therapeutic communication to a client experiencing severe anxiety. So which of the following responses are appropriate? Select all that apply. All right, so the first option is take some deep breaths. Can you tell me what you're feeling right now? The second one is everything will be okay. Don't worry so much. The third one is would you like to sit in a quieter area to help you feel more comfortable? The D option, or the fourth one, is let's focus on your breathing. Inhale deeply through your nose and exhale through your mouth. And then the last one, E, is I know exactly how you feel. I've been through something similar before. All right, so tell me the ones you think are appropriate. All right, appropriate just means it needs to make the minimum requirement to be appropriate. All right, it's not necessarily the best or the priority, it's just appropriate.
So the first one I know for sure is A,
Okay.
and then C,
Okay, I can see.
and then D.
All right. Okay, so you've completed them all. Look at that score. Zoom in for me.
Oh yeah. I'm a
Okay.
little nervous about some, so that's nice.
Yeah, the active recall game is on point. This is gorgeous. That's 100%. All right, so for the first one, you scored this correctly. Now, you chose encourage further discussion to explore the client's emotion. All right, and the rationale is provided for you there. All right, so this is fundamental in therapeutic communication. Changing the subject dismisses the client's concerns while providing reassurance may be non therapeutic because it minimizes the patient's feelings rather than validating them. So the key here is to validate those experiences and allow them to explore their emotions. Yes, 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 yes. Beautiful. I love it. All right, let's look at the next one. Okay, this was the one about the client who has the terminal diagnosis and they don't know how to go on. Yes, we acknowledge the client's feelings and explore their emotional state further. This is the option that keeps them talking, right? Allows them to continue talking. And you have a goal here, and that's why priority is mentioned. You need to assess for suicidal ideation, okay? Because, and that's a big topic on the NCLEX. They really always want to know if a patient makes a certain statement around that indicates or implies that they might have some suicidal ideations, that you got to go a little further with them. You've got to ask more questions. You're not allowed to just dismiss that and act like it's not a big deal. All right, so acknowledging the feelings and exploring their emotional state further gives you a chance to assess for suicidal ideations. All right, and in a future lesson we can go over suicide, that whole like clinic around suicidal ideations and how and why to assess for them, and like all the psych meds and everything that cause that to be an issue. So again, certification exam. So for safety, you have to, for the safety of that patient's life, you have to be able to assess for that. Excellent work. All right, next one. Look at this now, a select all that apply. This is, it used to be an all or nothing thing that if you had gotten one of these wrong, you would get 0 points. And you would only get 1 point if you got all of them correct. Whereas now they have partial credit. So that's a good thing. Partial credit is a game changer in NCLEX for select all that apply. But look at what you did here. You got every single point correct. So you would have gotten 3 points and not the 1 point that I'm indicating here. You would have gotten 3 points. So excellent work. All right, so what are you going to do for the patient who is experiencing severe anxiety? You are going to take some deep breaths. All right, can you tell me what you're feeling right now? That's very good. That's helpful. Would you like to sit in a quieter area, helping them to feel more comfortable? Very therapeutic. All right, let's focus on your breathing. So anything with the anxiety, they get the shortness of breath. They often feel like they say things like, I feel like I'm going to die. It's often because they're short of breath. And the respiratory system is associated with a panic button, so that when you are short of breath, you tend to feel like a sense of impending doom. So that's what they're experiencing. And it all goes together when someone's having an anxiety attack. So the best thing to do, get more oxygen to the brain and in the lungs, inhaling and exhaling, and then you'll be able to bring down those anxiety levels. Those other two, everything will be okay, are doing what? What's happening with everything will be okay. Don't worry so much.
Sorry, you're guaranteeing them something that you're not really sure of.
Absolutely. And you never want to pick that answer. And why I know exactly how you feel, I've been through something similar before. Why not that one?
Because you're not like really validating your feelings. You're just like putting yourself like I'm not really sure how to say it, but
Making it about you. How about we say
yeah,
it like that? I say
yeah.
any of those answers that make it about you are the wrong answers. All right. So never want to see I in any of your therapeutic response questions. All right. Was that the last one? Oh, we did have this one. Yes, you said I don't see any shadows, but I understand that you do. What is that doing? Validating their feelings. It's giving them a chance to be oriented as well. And they're going to thank you for it. If they know, if they're schizophrenic, they know they see things that are not there. They need that nurse to not be buying into their delusions or into their hallucinations. They need that nurse to help ground them in reality. So if you say, I don't see it, but I understand that you do. You're showing that I understand what schizophrenia is. It's seeing things that aren't really there, but you're helping to ground them in reality by saying, I don't see them. All right. And that's helpful for them because then they know, oh, I just see that. I can ignore it or I can, cope in the way that they know they can when in reality, no one else is seeing what they're seeing. Excellent. Excellent. The best response. I love that. Those are some of the toughest questions to answer. All right. And that was the last one, right? Oh, no, no, no. We still have this one, therapeutic or non-therapeutic. And once again, you scored every single subpart of this question correctly. So I would say that you got a little bit of something out of that lesson, would you? Or
Yes, it's so like understanding.
excellent, excellent. So I hope when you start going in to practice your 205 therapeutic communication questions that you will keep this in mind and see if it helps you. See if it takes you where you want to be with responding to those practice questions correctly and use your active recall to try to see if this lesson supports you in that. All right.